Hello everyone, Dr. Isi here again. Welcome back. So in today's video, we'll be talking about semen analysis. Everything you should know about semen analysis, from abstinence to analysis, every damn thing we should know about semen analysis, such that even before you take your semen analysis to the doctor, you already have an idea what your result is saying. So when your doctor is talking to you about your results, you feel this, okay, I had an idea of what the problem was. So semen analysis, what is it? Semen analysis is the first test a man who is trying or who has tried to get the wife pregnant and is not forthcoming does. That first test you do when madam is trying to get pregnant for years and is not forthcoming. That is the first test your doctor tells you to do as a man. And with people say semen analysis, why do we even do this test? What are the reasons for this test? First, to assess your fertility as a man. Second, for medical legal reasons in cases of rape. Third, we want to be sure that before an artificial insemination, your sperm is perfect, is good to go, because there are certain number of sperm cells we'll be looking out for. And again, after a vasectomy, we want to be sure that the vasectomy was successful. Then we can request a semen analysis to be done. Now, when your doctor tells you, Mr. Chika, because you guys have been trying for years and we have your wife has done all her tests and we have found out where the problem was and we have treated, we also want to be sure that you have done your test even before your wife does. In fact, this test is supposed to be done simultaneously. While madam goes to do her test, you also should go do your test. He's going to be advising you that upon giving your sample to the lab scientist, you are going to observe some rules, some protocols. First, you must abstain from sexual intercourse for 3 days. 3 days minimum, 5 days maximum. Some persons say 2 days minimum, but I have always used 3 days minimum. Abstain from sexual intercourse. You must abstain from alcohol. If you take a lot of alcohol, you not even reduce now, you must abstain from alcohol. You must abstain from smoking. You must abstain from herbal concoction, like those who like to take all these mix from all these herbal people. You must abstain from drug usage. There are some persons who are addicted to cocaine and other hard drugs. Why trying to do a semen analysis? You must abstain from this. When you have abstained, on the 4th day when you are going for your semen analysis, bear in mind that you must go in the morning. Why in the morning? Because in the morning, the level of testosterone in blood tends to increase. And when it increases, and you produce your semen analysis at that time that it increases, it gives you a better result compared to it done during the day. And when you produce your sperm, there is only one method we'll know for production, which is masturbation. And then we hear some men say, doctor, masturbation I will not do. There is nothing anyone is going to tell me I will not do masturbation. Oga, we argue not. If you cannot do masturbation just because you are not used to masturbating, you can actually have sexual intercourse with your wife. On this ground, your wife must wash properly just with clean water without soap or scented substance. You, on the other hand, must urinate before you do this. You have sexual intercourse with your wife, you urinate, and you must wash your penile organ properly with clean water. When this is done and when sexual intercourse has happened or when masturbation has happened, what do you do next? You put the whole of your penile cap into the bottle or the sample bottle the lab scientist will be giving you only. We don't need a sample bottle or a bowl you brought from home. So when you have ejaculated properly, ejaculated everything into the sample bottle that will be given to you by the lab scientist without spilling any sperm to the floor, then the lab scientist will be looking out for the color of the sperm. A good sperm or a healthy sperm is white or gray. Why white or why gray? Because of the high content of protein in it. He wants to be sure it's not bloody. He wants to be sure it's not yellowish. He wants to be sure it's not tubby, like it's having some particles in it. If not, the doctor would want to find out why the change of color in your sperm and maybe asking you some questions. Again, he wants to be sure of the amount you produce. The amount of sperm for production must not be less than 1.5. If not, there may be some form of abnormality. He also wants to be sure of the pH. 7.2 to 8 is the normal pH for a healthy sperm. If it's less than 7.2, we want to look out for some signs of inflammation. If it's higher than 8, we also want to be asking some questions about your prostate screen. You also want to look out for agglutination. When we say agglutination, we mean when sperm clump together. If sperm clump together, of course, motility will be impaired. You also want to be looking out for viscosity. The viscosity, of course, aids the motility of the sperm. When your viscosity is too high, of course, motility will be altered. So please, all these parameters and liquefaction time is also what he wants to examine. That at the time you brought your sperm to him, your sperm did not take too long to liquefy. What do I mean by liquefy? It didn't take too long to turn from that state it was when you brought it to complete liquid or watery state. That is the liquefaction time. Liquefaction time is very important in the analysis of sperm, because if your sperm takes longer than an hour to liquefy, of course it's going to take a long time to get to the fallopian tube where the egg is waiting to get fertilized. So when all this is done, he's going to be reporting. They are very important parameters we doctors we are looking out for. It is the count, it is the motility of the sperm, and it is the morphology of the sperm. The sperm, according to WHO, is from 20 million to 300 million. But some doctors make do with 15 million. And some also make do with 18 million. But I leave mine at the benchmark of 20 million. Then your morphology, which is the normal shape of the sperm, which has an overhead and a tail, must not be less than 30%. We have the normal form of the sperm and the abnormal form of the sperm. The normal form of the sperm, which is the normal morphology of your sperm cell, must not be less than 30%. So persons say 4%, 3%, 2%, 10%. All those figures have never worked for me. I am telling you now what has worked for me. And for motility, I've seen a lot of persons who keep having this misconception about motility of a sperm. First, total motility comprises of active motility and sluggish motility. Some persons tend to look at the total motility of a sperm, whereas the active motility of that sperm is more important. Because I am not bothered about the sluggish sperm, because we actually have the active sperm, the sluggish sperm, and the dead sperm. Nothing now concerns us about the dead and the sluggish sperm right now, but everything concerns us about the active sperm. Because of the less hours that the egg have to spend in the fallopian tube, we are concerned about the activity of the sperm to reach the egg timely for an ovulation to happen. Let's take, for instance, an athlete A and athlete B and athlete. Athlete A represents the active sperm, which has 2 complete feet. Athlete B represents the sluggish sperm, which has 1 leg, or rather, athlete A, 2 complete legs, athlete B, 1 leg, and athlete C runs on his hands instead of his leg. He has no leg, which represents the dead sperm. If I put a mango 50 meters away from this athlete and I said, in 2 minutes, go get me this mango, out of athlete A, athlete B, and athlete C, which one do you think will get this mango back in 2 minutes? Of course, it will be athlete A. Now athlete A representing the active, the progressive, the fast sperm. Outlet B now representing the sluggish sperm, and outlet C now representing the dead sperm. These two, B and C, are the sperm that do not have the ability to make your egg turn into an embryo. But outlet A, which is the active sperm, on your report you're going to see it as the active sperm, the progressive sperm, or the fast sperm. It's not just for your sperm to be fast, it is to be fast and move in forward progression. The progression of movement has to be forward and not bend sideways or bend backwards. So yes, progressive, active, or fast sperm in total motility, very important when analyzing your sperm and not looking at total motility in general. So for active motility, which means that sperm that moves in forward progression must be 40% and above. You must not have less than 40% for your active sperm. So ladies, bear in mind that within 6 to 8 hours, the active sperm of your husband will be doing its job for fertilization to happen. And then when fertilization happens, what is next? I will be talking about that in my next video. Why will implantation not happen after a successful ovulation? See you on my next video.